plan so cunning you could put a tail on it and call it a weasel.
Hello, Premiere Eby. It's Paul Adams with the BC Rural Health Network. Just a few more F words for you. Fun fact, FIFA is coming to town and folks will be finding they need a fortune just to find accommodations as we play footy on a different field. But here in the fields behind me, 5 generations of my family have frolicked, farmed, and frankly faced down their fair share of health challenges. My father, a faithful family physician, fought for 50 years for folks facing formidable barriers. Now I find myself focused on solutions for that 5th generation and for our rural friends far less favoured when it comes to accessing care. Unfortunately, the facts and figures we need from our fearless First Minister of BC have faltered, and too often we're left to fend for ourselves. So today, from a field in Princeton, on the traditional homelands of the Shemukmuks, Silks Peoples First Nations, we offer a few more F words, focused on families, funding, and the future that works for everyone. But don't just take it from me. Here's Jacqueline Podwells, the Canadian philanthropist who's fighting for a future where housing is healthcare.
Hello, Premiere Eby. It is Jacqueline Podwells here with Housing is Healthcare. And I will drop a lot less F words since my kids are around. But I am going to drop the one big H word, and that is housing. So I grew up on Silks land in Kelowna, BC. And I did not know a lot about rural communities growing up, but I have learned a heck of a lot lately. And I will tell you that building a facility in Vancouver so patients can access care will drastically change the lives of almost every British Columbian, because everybody knows somebody who has to travel to Vancouver in order to access care. I know at least a dozen personally, including my mom, who had a double lung transplant and experienced extreme stress the 3 years leading up to it, wondering where she was going to stay and how she was going to afford it. So I'm here to make the Hotel of Hope come to fruition. We want your help, and we want it to be woven into the system so that medical appointments correspond with accommodation. So from one Canadian living across the border in Chicago to another back home, I say elbows up, and I say let's get this done. Thank you.
Well, I suppose we could form an interdepartmental committee to examine the feasibility of monitoring a proposal for admitting patients at an earlier date.
How long would that take to report?
Oh, not long.
How long?
Oh, about 18 months.